Hi, this is Dr. Gabriele Miotto. I'm a plastic surgeon in Atlanta, Georgia, and I want to talk to you a little bit about facial contouring procedures. Facial contouring procedures are basically any surgical or non-surgical procedures that improve the highlights and shadows of the face to make it look more attractive, more symmetrical, and even more rejuvenated. Common facial contouring procedures I do are neck liposuction, which is basically taking the double chin out with a local anesthesia, a small little cannula that goes under the skin and then just removes permanently the fat out of this area. Non-surgically, that can be done with Kybella, which is an acid that melts the fat. But in my opinion, doing both procedures, I just see that liposuction under local anesthesia has a much faster recovery, more predictable results, and also you can see the results faster. But it is an option for patients that cannot have local anesthesia. Other common contouring procedures that I do also under local anesthesia is buccal fat pad removal or bichectomy. So for patients that have full faces and have a lot of volume in this area and doesn't have this hollowing under the malar area, sometimes that's due to hypertrophy of a deep fat pad that we have in this area. So we can remove the excess part of that, the excessive lobe of the fat pad from the inside of the mouth with local anesthesia. And then we can improve the facial contouring and make the face look slimmer and a little more angled with that. That procedure can also be done during a facelift when the patient has the face that is a little bottom heavy. Usually it's also due to a hypertrophied buccal fat pad. So we remove that through the facelift when we are doing the deep plane tightening and repositioning of the tissues. Another nice facial contouring procedure is putting fat on the face to highlight the cheeks, highlight the lips, highlight the temples and the upper face. And that can also be done under local anesthesia or under general anesthesia. We are doing recently also some suspension sutures for less invasive brow lift and neck lift. So it's not as durable as a facelift. It will last for about a year or a little bit more. But we can do a mild brow lift with that. Sometimes we can do a little lift of the cheeks, a little improvement of the jawline and the jowls, by placing the fine sutures under the skin, the threads, and then attaching it to the tissues a little bit above. For the neck, we also have recently a new option called Elevate, and this is a little more invasive than just the simple threads, but is also done under local anesthesia. We do undermine the skin with liposuction, and then we place the threads from the chin all the way down to the mastoid area, lifting and contouring the neck so we can highlight and emphasize a little bit more the jawline. So we have several options. Those options can be combined either under local anesthesia or under general anesthesia. And of course, we need to have the patient come and be evaluated for us to see which procedures make sense. And while we'll really emphasize the face's highlights and shadows to make the most beautiful result without telltale signs of the procedure. If you would like to get more information about that, come for a consultation in the office, and it will be a great pleasure to see you, to talk to you, analyze your face, and make sure we offer to you the best procedures for your goals.